Moyo onse okosa uyu amai musatanda ule nawe mavuto yose tipitamo aya yazapita iwe yazapita.
So welcome everyone, welcome to this amazing session that you're going to have today. This is a dialogue session that you're having with religious leaders and young people. So today's session is going to focus on just having dialogue with the religious leaders, faith leaders, and looking at how this integrates young people in the response to HIV. So my name is Brian Otieno from Kenya, and I'll be moderating this session here today. And I am part of the Faith Community Initiative that's focusing on reaching out to religious leaders to improve the messages of hope, and also looking at how religious leaders can be the response of HIV prevention and the response globally. For this particular session, we're going to look at how the dialogues can be used to bring out discussions among religious leaders and young people. And just giving a brief background of this session is survey in low and middle income countries continue to show that only a third of young people aged 18 to 24 years in sub-Saharan Africa had accurate knowledge about HIV transmission and prevention. So levels of knowledge are lower among adolescent girls and young women. And this is mostly because there's lack of information. Yeah? To compound this, recent data indicates that only 25% of adolescent girls and 17% of adolescent boys aged 15 to 19 years in Eastern and Southern Africa region most affected by HIV have had access to HIV testing in the past 12 months and received the results of their last test. So testing rates in the Western and Central Africa are even lower, as you can see. So for this workshop, we're asking ourselves, can faith and spiritual leaders who have influence and role in behavior change and social norms in Africa engage with young people to change the situation? So the workshop will engage faith leaders, as I mentioned, and purpose showcase how dialogue between these two groups are very essential and potential in knowledge management and to increase demand and access to care. So with me today are amazing team of religious leaders who I'm going to introduce in a few. And just to see that with these religious leaders, having such dialogues, having such information, it's important for young people. As a young person, I believe that a religious leaders impacts my well-being and knowledge levels in a way that influences how I behave. So just a behavioral perspective on how religious leaders can be at the forefront of modeling and bringing this conversation. So I'm going to introduce a list of religious leaders and young people. And today with us, we have Chengetai Chafamba from Zimbabwe, and we have Apolesta De Costa from India, and we have Dr. Jacob Kipchilis from Kenya, my home country, Joseph Richard Magongo from Uganda, and Reverend Evat Mugarura from Uganda. And lastly, we have Reverend Francois Nungesaba from Rwanda. Welcome everyone, and welcome to this particular session, and really appreciate for you being here and for the time you've given us today. So I'll just jump straight into the questions. So please introduce yourself and the work you do with young people in the faith settings.
I'm Reverend Jacob Kipchilis, and I'm an ordained children and youth religious leader with the Full Gospel Churches of Kenya, and I've been working with the youth since 2005. And also I work at Eastern Teenage AIDS Relief Program, which is under the Catholic Church. And in the church setting, I teach the children and the youth on faith matters, supporting those affected and infected with HIV.
I am Joseph Richard Magongo, a Pentecostal pastor. I pastor at Excellers Chapel. I'm the National Youth Minister of the National Fellowship of Born Again Pentecostal Churches that brings together a membership of 30,000 churches. So my duty is to oversee the youth and the children in that organization. But there's also another organization called the Alliance of Pentecostal and Evangelical Churches, which I represent in IRCU as the youth minister, and a committee member of the Youth Interfaith Network. That's a branch of IRCU that helps us to engage the youth in different activities. But I've also participated under Ministry of Health in developing literacy material for HIV for children, adolescents, and to make sure that they understand what prevention, care, treatment, and HIV supporting services. So we have done that with the refugees and other communities around us. That is me, Richard Magongo.
Hello everyone, my name is Apista Marian Da Costa, and I am the Psychosocial Program Lead at Human Touch Foundation. Basically, Human Touch Foundation is a youth-led organization working across the state of Goa, and we work with young people in the areas of health, and our mandate areas of work include HIV, tuberculosis, sexual and reproductive health, substance abuse, and cyber safety. I am a psychologist by profession, but an advocate, a young advocate for adolescents and young people living with HIV by passion. So through the associations with the faith-based organizations, I have been able to, engage in incidents of stigma and discriminations against young people living with HIV, especially through delivery of awareness sessions among faith-based communities, and also through faith-based organizations. I've been able to, connect to a lot of adolescents and young people living with HIV, and reach out to a wider network.
My name is Chengetai Mano Chipamba. I work for the Lutheran Communion in Southern Africa, that's LUTSA, and I work under the HIV department under a project called InfoHeart. Basically, InfoHeart is a program for the young people, targeting the young people with empowerment. So we use the computer to reach young people with life skills. In empowering the young people, we're saying it's not easy to bring the young people to the table to teach them about HIV, but through the use of the computer, we can engage the young people and bring them to be empowered with life skills. In InfoHeart, we have a number of projects across the Southern Africa region. Namely, currently we're operating in Zimbabwe, Zambia, Namibia, and Malawi. And it's been so wonderful working with the young people. And I tell you, the InfoHeart project has shown me that working with the young people is such a fulfilling thing, and the young people definitely can change, and they've got the capacity for positive behavior change when we use the right tool to reach out to them.
I am Reverend Francoise Nyonsaba from Rwanda. I'm working, serving as a church minister in Presbyterian Church in Rwanda. I'm also a volunteer in WCC Ecumenical HIV and AIDS initiatives and advocacy in East African region. We used to bring together youth and have different seminars on how to fight HIV and AIDS, how we can help people with HIV, how we can fight against SGBVs, how we can help people who have faced those challenges of violence. So we have different projects with youth that are aiming to empower youth.
I am Reverend Canon Mugarura from Kampala, Uganda. I am the Executive Director for Africa Youth Leadership and Health Initiative, which is usually abbreviated as ILEAD Initiative. We use that acronym as intentionally because ILEAD means that we want young people to take the leadership role in issues that affect them, in issues that they must participate in.
So kindly just tell us, what are some of the recommendations you can offer supporting young people and HIV knowledge in the community working?
Yes, there are about 5 recommendations that I would like to make that can assist, one, the faith leaders and also the young people on how we can be of benefit in making sure that HIV AIDS knowledge is everywhere. Because in Uganda, for example, every single day, the statistics show that 151 people get infected with HIV. On the sad note that 65 out of 100 of these people are young people. So that's not a very good story here in Uganda. So as faith leaders, one, I would like to recommend integration of HIV messages into all church-related events. It's also important that we talk about prevention in these as we uh, share with the young people prevention, care, treatment, and other support services, because we need to give them an entire package. I'm also a champion of gender-based violence, trained by ICASA Faith. These gender-based violence goes hand in hand with the HIV messages. So as all these must be integrated in those communications. The other recommendation I would make is mobilization. One of the things that religious leaders do when they speak, usually everybody listens. When my children come back to school and I say something as a parent, they say, the teacher said, the teacher said. They don't seem to respect parents or honor our word, but the teacher's word is more powerful. The same comes to the religious leaders. When we speak, the community listens. When we speak, the young people listen. So the young people, every activity we do, we must be able to be those mobilizers of young people, bringing them together. And when we create these events of bringing them together, that is a good platform to share HIV messages. Let me tell you what we have done in our organization. We have organized events like fashion shows to bring young people together. We've organized what we call medical camps, And when the young people come together, business exhibitions, because we know unemployment is a problem. So when we mobilize people to come for these business events, for these talent events, we use those opportunities to share HIV messages. So we've designed literacy materials that we share with them. And we found this very helpful because they have then gone back and reached out to their young people and their communities. And we've seen that the information trickles down very fast. The other recommendation we have, I would like to suggest to my faith leaders that has worked for us and our communities, is capacity building. So when we bring them together, we use this opportunity to teach them, and we turn them into what we call trainers of trainers, so that they can go outside there and become our representatives in the community. So we also ask them, as you read your Bible, as you do your Bible study, as you do your cell groups, talk about these messages. So what we do, we involve them in several kinds of trainings. It could be skills training, it could be HIV related training. So in all the trainings we have, be it skills training or soft or hard skills training, we put a component of the HIV messages that we give out to them. And so they get a whole package. They get a skill. Not only do they get a skill, but they also get a behavior change skill. And this helps them to go in the communities and influence others. So I have realized that we need to empower religious leaders. Some of the religious leaders are not trained in HIV, because there's been a lot of stigma, and somebody seen with HIV in the church, they are seen as sinners, as people who are promiscuous or involved in sexual immorality. But the mind has to change. Through these capacity building programs, the mind has changed. The pastors now have to know that it's my responsibility to be equipped with as much information as possible. But my friends have also realized that we can't do this alone. Collaborations, partnerships with other organizations has been very helpful. And together we develop a synergy of information that we give out to the young people. So collaboration has been very helpful. Formerly, the church didn't want to hear anything to do with HIV, didn't want to hear anything about, taking medicines. From the Pentecostal perspective, we believe a lot in prayer, we believe a lot in miracles. But we have appreciated that there is a section for prayer, there is also a section for medicine. For medicine, you can pray and take your medicine at the same time. That is, so collaboration has helped a lot in that area. One of the things, as I end, what we have focused on so much is advocacy. Advocacy, youth participating in designing, implementation, and monitoring of HIV programs. So when we design these programs, we ask the youth to come, let them give us their ideas. And we find the youth even suggesting we can come up with a song, we can come up with a drama, we can come up with a poem. So advocacy is what I really want to recommend, because it spreads the message, it demystifies all the mysteries around HIV/AIDS. I want to stop there. Those are 5 recommendations: integration, mobilization, capacity building, collaboration, and advocacy.
I'm going to share in twofold. First, I'm representing LUTSA organization and the InfoHeart project, and also I'm representing the young people. Having worked with the young people for a long time, when the project started around 2007, there are some things which we have learned through working with the young people. So as looks at the approach which we use, which we are recommending also to other organizations and to the young people to use, is number 1, capacity building of church leaders. In as much as we're saying the church leaders are the pillars, they must be there to support the young people. They can only do that when they've got the skill, when they've got the capacity to be able to support. Without that, whatever they're doing, there won't be effectiveness in it. Number 2, we come to the implementation. When we're implementing, we're saying the approach number 1 we are recommending is mainstreaming. So mainstreaming allows us to implement with minimum budget. What we're saying here, we're saying, let HIV and AIDS, let the issues of the young people be part of what we do every day. They should be popular. They should be, we mustn't think about it that we have to do an activity on HIV or we should talk about HIV. It should be part of what we do every day. When we're implementing, what are we implementing? In our organization, through years of experience and lessons learned, we are saying number 1, give access to information. Believe me, everyone wants information. But when it comes to HIV and AIDS, some of the information is not straightforward. Like you come to me and say, I've got something between my legs and I'm not sure what it is. Could it be an STI or is it normal? It's not easy to say that. And in our culture, issues of sex and sexuality, they are not discussed in public. But when you teach someone how to access information, they'll be able to help themselves and they'll know where to go with their problem. So access to information is number 1, what we should give, not the information. Information, yes, we can give it, but that's like giving someone a fish. We want to teach them to fish, just teach them access to information. In the InfoHeart project, we do computer skills, and we're saying, we teach about HIV, drivers of HIV and things like that. But above that, we teach about the computer skill, which you use in accessing information, in communication, and furthering your education. So that way you can actually further access information throughout your life without having to go to a facilitator or to a project to get information. The other thing we talk about when we're talking about giving skills is livelihoods. Believe me, no matter how much information we give, without the financial support, the resource support, the livelihood, we're not doing anything. That's why there's disconnect between the level of knowledge and the practices. It's not talking to each other. We say there's so much knowledge, especially in Africa, Zimbabwe, Zambia. Namibia, there's so much knowledge, but what is on the ground is not the same. We're missing a component, livelihoods. So we need to support the young people with livelihoods. Faith-based organizations, we must create a safe environment for young people to interact. Young people learn through sharing experiences. So these experiences, they need to be done in a safe environment. Whatever way we can do, let's create safe spaces for the young people. And when we're doing this, young people, they don't need to be pointed the way to say that's the way to go. They need you to hold their hand and work with them. So in InfoHeart, in the LUCSA InfoHeart, we actually do classes, and the classes go for a minimum of 4 months. My 4 months was saying, if we just invite you to a meeting and tell you and you go home, the chances of it being reinforced to be part of your lives are very, very slim. But when you do it every day for the next 4 months, sometimes you go up to 6 months. In some programs, you go up to a year. The behavior change definitely happens. And also the chances of getting employment after that, they are very high. So believe me, I'm here to share with you the LUCSA InfoHeart concept, which talks about capacity building of leadership, mainstreaming, access to information, livelihoods, and creating a safe environment for young people to share their experiences.
The first one that I need to mention is to emphasize on teaching. I encourage youth to accept to be taught, to accept to learn from others. So I can encourage youth to accept to participate in those seminars. Secondly, is about to train the parents of our young people, because many of our parents are not aware of HIV. Thirdly, I can say that young people may have many questions. So what I can recommend is that these young people may seek the informations or the answers of their questions to the right people. In our cultures, young people don't like to have a conversation with their parents. So what I can encourage is that they can also seek this information from their parents, from medical doctors, or from their church leaders.
So through I Lead initiative, we ensure that young people are embraced, especially those who are living with the HIV, accessing knowledge on HIV and AIDS so that they know what to do, when and where and how, and also accessing services that are needed in their lives. So I Lead is out to do that. So we do this by young people together, training them. We have leaders in communities, we call them youth health advocates. And these go out to reach out to fellow young people so that they can bring out this information to them, and a way of equipping them to know what surrounds them, especially in regard to HIV, which is our focus now for ICASA. We have a number of activities that we do that relate to HIV, including prevention of drugs and substances. The other issue that we address is definitely to do with poverty and unemployment. And how do we do it? Because we know household income is very important. So we encourage our young people to have small projects that can help them to earn something that they can live on. So as especially young girls, so that they don't have to be lured into having sex for money, which is common. Then the other issue is advocacy. We actually do advocacy, advocating for the rights of young people wherever we are. We usually have dialogues between the young people and religious leaders but also with their parents, because we know it is a collective effort for the young people to succeed. But we have that big community of religious leaders that we engage to ensure that whatever they do, they have youth agenda on their table. What do I recommend? If we have to manage the HIV and AIDS strategy of now 95, 95, 95, we cannot leave the young people behind. How do we not have serious agenda for them in regard to not only HIV, but all the development around HIV, making sure that their voices are heard, making sure that their rights are not violated, making sure that the services they need are provided. We have to create a safe space for all our young people. The challenge we have is that currently we don't have enough programs that are funded and targeted at young people. I recommend that whatever programs we have, the agenda for the young people must be highlighted. It has to be highlighted in national plans. It has to be highlighted in faith institutions, budgets and plans. Again, I want to recommend that let the young people lead themselves. Again, I also want to encourage a stronger network of young people globally and regionally, even nationally, so that we can begin to work together and share information from different corners and learn, borrow riff or that we can use to improve the programs that exist. I think with those recommendations, I can say that once we give space to the young people, in summary, have appropriate programs and agenda for the young people, and corresponding funding for all these programs put in place, and strong network and partnerships.
Personally, I want to support what my colleagues have said. And in my organization, we do visiting them, like especially those who are very sick. We do home visits. Then maybe the recommendation to the young people, I would really want to they make sure that they take their treatment correctly, continuously at the correct time, and they follow what the OTC operation, that is the zero missed appointments, zero missed drugs, and then zero viral load, so that they really make sure they take their drugs on time. The other issue about maybe this one, like incorporating messages of hope in our services, and then we also need to have that meaningful involvement of the young people in their decision making. Then there is a word in college in which we make use of peer mentor. We identify a peer mentor who has accepted their condition and they are taking their drugs and they are virally suppressed, so that at least we make use of like the positive peer pressure. There's a name in Kalenjin which we use pakule. Pakule is a Kalenjin term meaning a close mentor or an age mate who can make decisions on your behalf. So when we make use of these peer mentors, because I know the youth listen to the youth, and if I say like right now, take your medicine, then you may not get much as a youth. But if another youth informs them or their colleague tells them it's good to be taking medicine, that one they will really take it seriously. So we are really capitalizing and leveraging on this positive peer pressure.
Okay, thank you. And I would say I 100% agree with what my colleagues have, just recommended. And faith-based leaders, yes, they are the voice that, represent major section of the society. And they must raise voices towards issues that need to be resolved. Faith-based leaders and religious leaders, they significantly influence the public opinion. and changes can be brought about in the social norms, through these religious leaders. We see that through preaching we can make a lot of people aware about the struggles and challenges that young people living with HIV or people living with HIV face, and how communities can help in these struggles. And ever since the inception of the HIV epidemic, we see that lack of awareness about HIV acts as a major barrier in ending the long-standing HIV epidemic. And even today, we realize that when we have conversations with young people, we see that they do not have the information about topics that are necessary while growing up. So, faith-based communities, again, they religiously follow what the teachings of the religious leaders are, and we can use this to, our advantage and preach about topics related to HIV, things that are necessary. So, dissemination of accurate knowledge about HIV is very crucial for the prevention and reduction of, new HIV infections. And of course, through faith leaders, HIV literacy can be propagated to a wider audience. Also, in the field of HIV, we see that there are a lot of people who have the passion, a lot of young people who have the passion to work in this space. But something that stops them is, the funds or the financial status. Youth leaders and religious leaders, they are the voice of the voiceless. So they represent the communities that go disregarded, in the society. And a collaborative effort of young people and religious leaders can identify issues that these young people face, and we can actively engage the members of faith-based organizations to effectively resolve or help these people who are in need, or even those who are affected, maybe the caregivers, the family members, and other people that are affected by people living with HIV. And this can be done again through community participation. We can also have support groups for people living with HIV and their caregivers, so where they can express their concerns and feel better once they express it. Again, we see that living with HIV is not an easy thing. Most of the young people living with HIV, they are at a higher risk of developing mental health issues, and we have seen this, with our conversations with the young people. And through faith-based organizations, we can, integrate spirituality into therapeutic sessions, and we've seen that when you involve or integrate spirituality in therapeutic sessions, it does help in helping resolve the mental health concerns. It gives them a hope that they also can dream like any other lay individual. So I think having a safe space where they can express their issues and concerns and seek professional help with regarding these issues can play a vital role in the HIV epidemic. Also, this will also help them in reaching the optimum level of well-being, which is very necessary for young people and adolescents living with HIV.
Thank you so much. So, what are some of the greatest challenges, policy and legal environments around HIV knowledge and prevention, or resources that you have working with young people in your community?
Yeah. So when I speak about integrating spirituality in our therapeutic sessions, we see that in when we engage with our young people, we have a format that we follow where it assesses all their needs, from biological to social life, to their economic lifestyle, their financial needs, their educational needs, even their psychological needs. So it gives us a clear understanding of what are the needs that need to be taken on priority, and some of the needs that can be handled once one issue is catered to. So once we identify these needs, we use spirituality. Spirituality may not just be about having faith in any religion or in God, but just finding meaning in life. we see that spirituality plays a vital role in these therapeutic sessions when adolescents and young people lose hopes, thinking that they are living with a chronic illness. Yes, it is a chronic illness, but it is a manageable illness as well. And when we are talking to them, it becomes sometimes very difficult to confront them in the issues that are related to HIV. So when we speak about spirituality, it gives them a sense of relief. Okay, I can do something in life. When you give them information about other people, their mentors that have gone through these the similar issues, when they can have a peer support system, as my colleague has mentioned, where they can share their lived experiences, they can share whatever they have gone through, how they have resolved it. And when they build trust with each other, it helps them a lot. So spirituality, as we see, has impacted positively a lot on these adolescents and young people living with HIV. And I think if other communities and other NGOs and other organizations that work with adolescents and young people living with HIV, if they also integrate spirituality into their counseling sessions or therapeutic sessions, it would go a long way and it would be very helpful.
In my church, we have started something which seemed to be strange to our Rwandan culture. Normally in our culture, it is strange to talk about the issue of sexuality with young people. Normally it is a shame to talk about that with young people. So I see this as a very big challenge, because if our young people don't know about their reproductive health, about their sexual use, it is very challenging to prevent themselves against HIV or other transmitted disease, sexual transmitted disease, and also unexpected pregnancy. So what we are doing is to start this conversation, the seminars of youth, to teach them about their reproductive health and give them the safe space.
We in my organization in EDAP, we offer care and treatment in a Christ-like manner, and also we offer, like, the messages of hope is like when the youth or when the adolescents who are infected with HIV take their drugs, they become virally suppressed and they're able to live a normal life like any other person. And then at the same time, we're able to start treatment immediately, not like before where we used to stay until they reach stage 4. Nowadays, you treat and you test and treat. Then now we hold seminars, though currently about the COVID, but we used to hold seminars, but nowadays we do it virtually, but not as frequent as we used to do before the COVID era. But now we nowadays encourage one-on-one support group. There was sometimes we could have sports and games activities, so that at least the youth are able to interact with each other. We attach all our adolescents with a community health worker, so that they're able to follow them in the community. In the clinic, we have the electronic medical records, where now we also able to capture the spiritual screening, because we have a medical social worker in all our clinics, who is also a member of a family team, which is comprised of the family nurse, adherence addiction counselor, and then we do networking with other service providers. And we've done also the training and empowering of faith leaders, so that in support of the adolescents and young adults living with HIV, and also the CAL HIV. So when we empower the faith leaders, so that we work together to even enable the children to be on treatment, those who are infected and affected, especially those who are infected, the faith leaders now, they incorporate the messages. We encourage them to incorporate the messages of hope in their services, so that now the children are encouraged also to continue, and the youth to continue taking their drugs.
I developed what we call the 5 C's, a tool that we use called the 5 C's. And the 5 C's involve competence. Well, number 1, And we tell the young people, you have to be competent, and this is where we give knowledge and information on HIV, AIDS, prevention, care, treatment, and all the other support services, but also information relevant for them to survive. After the C of competence, we talk to them about charisma. We're saying that as a young man, you have a duty to influence others. That once you've got this information, go out there and begin to influence your young people. The other C is called character. Your charisma, we tell them your charisma will take you somewhere, but your character will keep you there. So we have to share with them that if you are negative, your character can keep you negative. If you're positive, then yes, live positively, but make sure that your character doesn't take you into new infections, doesn't take you into drugs, doesn't take you into other habits that will make your situation deteriorate. And the issue of character, this is when we encourage those who are living positive to take their drugs. And then the fourth C is chemistry. We tell them that yes, now that you've got the information, you're very influential, your character is in check. Now begin to connect with them and share this information with them so that we develop a critical mass of youths that can be ambassadors of this information that we take around the country. Then the fifth C is Christ. We tell them as religious leaders that you can do all these things, but if you do not have Christ in your heart, all these things are useless. The other tool we have used, we labeled it and called it the 4H. One of them is the head. We say we want to give you capacity building, give you information, give you knowledge so that you can go outside there and be our ambassadors. And then after we've given you knowledge, we want to equip your hands as we teach them HIV knowledge and all the other things, but we also give them a skill. So it's a complete package. So when the youth goes through this program or this tool, they come out one fulfilled. They have something to do in the community, something that keeps them busy. So when we deal with the head, we deal with the hands, we also deal with the heart, because from the heart, we've seen some youths who have said, now that I've been infected with HIV, let me go outside there and also give it to everybody I see. But when you deal with the heart, they begin to reconsider those decisions and they choose to live positively, but also become ambassadors that are going to stop others from engaging in reckless behavior. The other H is the home. We say, you know what? You're not living in an isolated place. You're living in a community. So this information, take it back to the community. Churches have also used the tool of medical camps. So we turn the churches into hospitals and the youth come. Do you know why? Because some youths fear to go to these medical facilities. So what we do, we bring the medical facility in the church.
With the LICSA InfoHeart, the tool number one which we are using is the InfoHeart concept itself. The InfoHeart concept uses a bait, as in fishing. For you to fish, you need to have a bait to catch the fish. So the IT, the technology is bait number one, which we have. What can invite the young people and be meaningful and empowering to them? And the thing we found was IT. So the IT concept, which you use, is an innovative approach. It's attractive to the young people and it brings them to us. When they've come, then we bring the IT concept and we bring the HIV and we bring the gender issues and we bring the empowerment issues and all other things which are relevant to the young people. But believe me, after the first 3-4 sessions, if you continue with IT, they'll stop you and say, hey, we haven't done life skills in a long time. To show that this is something which they can relate with. They feel it's building them and they would want just to learn about the computer and not learn about themselves. The tool number 2, which you use, is the peace building. Because a lot of young people have made mistakes out of anger, out of seeking revenge, and things like that. So what we say is peace begins with you. The other tool we use is gender justice. And in the gender justice, we've noticed that a lot of programming, they run into the mistake of putting equality before equity. And as a result, we say female leaders are not good enough because we just pick them and say this is 50-50 without empowering them. So we're looking into gender justice where we're saying there should be involvement, there should be empowerment so that we end up achieving the equity.
And what are some of the greatest challenges or some challenges regarding policy, environment, legal environment, surrounding HIV knowledge, prevention resources that you're facing?
The challenge number one we have is I'm sending it to the church to say, as a church, we cannot assume the ideal situation is what is on the ground. We want the young people not to engage in sexual activities. We try to deprive information as the means of making sure they don't engage. That formula is not working, and it has proved over time that it doesn't work. We should find new formulas to use. We should also look critically into the issues of LGBTQIs, which we're not looking into. Really, what are we saying? Keeping quiet about it, is it a solution? No, it's not a solution. The issue of condoms within the church, is it a solution when you don't talk about it? It might be there in the policy, but in terms of implementation, that is not there. Then the second challenge we have is the financial resource to support the brilliant policies we have. Government have got brilliant policies, believe me, if those were put into implementation, things will work. But as it is, no, the sound policies, they don't have the financial backing to put them into implementation. Then the other thing we have is the unequitable distribution of resources. The second one is reaching disadvantaged communities, disadvantaged groups. We're still weak there, that needs to be improved. So basically, these are the challenges I think needs to be addressed. So financial, reaching to the disadvantaged groups, and also making sure that the little resources we have, they are distributed according to need. Give more where the need is. We are agreeing that faith-based organizations are doing a lot. I'm kindly requesting and appealing to government to say, we should have means, the government should have means of tracking the work being done by faith-based organizations. Then to funding our partners in government, I would like to encourage them to trust faith-based organizations with funding, because they're actually doing a lot. With a bit of some funding, they'll do more. And also for our partners to say, yes, we've got organizations which are formed and run by young people, by the youth. We should also support them so that they can prosper. That's where the concept is for the young people, by the young people come. But if they start something and they don't get financial support, then whatever they are doing is likely to fail.
Some of the challenges that we are facing and would like UN to come in, some of our cultural practices here in Uganda, for example, in the eastern part, we have genital female mutilation. And then we also have the traditional practice of circumcision in the Bagisu. These methods are still done traditionally, and we need assistance so that we go there and sensitize them, because through these methods, a lot of HIV and is transmitted. Testing is not allowed for children that are below 18 in some countries. In Uganda, we managed to advocate about this, and the age was lowered to about 12 years. So we can test children below, below 18, starting from 12 years. One of the things we need to change, and the major challenge we found, is the stigma. In the churches, when somebody comes up and they say, I'm HIV positive, they automatically say you are your sexual immorality. We need to sensitize these, my fellow faith leaders and the youth outside there. We've had a big challenge, which we are dealing with: miracles, prayers versus medicine. And we've seen that when somebody is HIV positive and they are prayed for, they leave their medicine. and sometimes that they begin to deteriorate. Yes, we believe prayer works. Yes, we believe Jesus heals. We believe, but before the miracle happens, we want people to keep taking their medicines as they ought to take them. So those are some of the challenges we have faced, and the ABC approach, which we have been using: abstain, be faithful, use condom, and we've said if you don't do this, the D is the die. You will die. And so we are doing our best to make sure we educate the youth, the religious leaders, and those people of influence to make sure these challenges are dealt with.
We faced a lot of challenges about COVID because we used to have this talent show. Our youth have a good way of rapping, and they will still have stigma and discrimination, which is still really rampant. And then we still have a lack of supportive services and systems in religious settings. And we still have people who are telling the youth what to do as opposed to maybe listening to them, like you want to give them advice. So basically it's good to maybe listening to them. And then we also lack, as far as in our nation, we lack a family friendly tax system. The tax system is not family friendly. We still have unemployment. We still have the youth lacking income generating activities. And then there's this lack of dialogue between the adolescents and the young persons and the faith leaders. They really don't have that dialogue between themselves. Maybe me as a faith leader, I would want to tell them what to do, but not necessarily listening to them, as I had already mentioned. We also still have lack of like phones and internet for like some virtual meetings. As much as we want to do like virtual support, sometimes maybe you lack internet, or even sometimes there are no phones. And I will conclude by saying that I will mention what Dr. Motoku, our clinical director, who says that promise less but deliver more. And then you promise less and we do more. So that's what we do follow. We promise less but we deliver more. I also want to mention our managing director, Alice Joroke, who tells us that we need to give the poor the best quality because they cannot afford to buy in a Christ-like manner. And I conclude by what Father Rick embraces, and he tells us to continue embracing Karibu Karibu, the one of welcome, welcome.
Yeah. So the four things that I see are the challenges that hinder, the HIV knowledge and prevention. First, as my colleague Richard has, rightly stated, HIV still today is, still associated with morality, and because of this, people living with HIV do not want to disclose their status. Yes, we have reached the stage where we talk about the campaign, undetectable is equal to untransmittable, transmittable. And although HIV treatment or ARVs have been accessible for free, we see that young people living with HIV and people living with HIV, they suffer from recurrent treatment fatigue. So because of this reason, they're not able to, maintain the undetectable level of virus in their body. All the communities that are actually working with young people living with HIV, I would want them to advocate about the new medicine or the injectable ARVs that are now available in the market. So if these are made available to all those people living with HIV, if they can take this, I think it would have a great impact in not transmitting HIV to other people. Second is that, although we see a lot of advancement in the scientific knowledge, awareness about PrEP and PEP is not done appropriately, especially in the country like India. Drugs called PrEP and PEP is only known to medical fraternities and no one besides that. So when we have conversations with young people, who have been recently diagnosed with HIV, they ask us if we actually knew about these drugs, we could have protected ourselves and our loved ones from acquiring HIV. So we need to talk more about these drugs so that we can prevent the transmission of HIV. And again, HIV testing, young people do not want to go and test themselves because of the fact that they'll be labeled or they will be judged. I am aware that in Africa we do have self-testing kits available, but in India it is still not available. So if self-testing kits were made available, especially in a country like India, it would encourage young people to go get themselves tested without being charged. Yeah, and the fourth thing is that although we see a lot of development in the legal field, we do have laws and acts that protect the rights of people living with HIV, be it social rights, educational rights, employment rights, or so on. But what happens is that although these acts and laws are there, they have not been implemented as policies. They have not been notified in the different states, especially the HIV Prevention and Control Act of 2017 that we see in India. It has not been notified for so many years in the states. So when we do face incidents of stigma and discrimination, we are not able to fight for the rights of these people living with HIV.
So thank you, everyone. Thank you for tuning in. It's been an amazing session with a great team of religious leaders and young people, and we're really delighted that we've had this session and for really joining us. I really appreciate having us and being with this amazing team of religious leaders and young people. Thank you so much.
Enough is enough. Corona. Enough.